Hi everyone, my name is Crystal Diaz. I am the media specialist and community health worker here with Union of Pan Asian Communities. My pronouns are she and her. I have black hair, medium length, light tan-ish skin, I'm wearing a pink shirt, and I have a white wall behind me. And today with me, I have our program coordinator, Dominic De Los Reyes, and I'll let him introduce himself.
Hi, everyone. Thank you, Crystal. This is Dominic, and my pronouns are they and he. I'm a light-skinned person with dark brown hair. I'm wearing black frame glasses. I'm in a gray chair with a white background and wearing a gray button-up shirt. So I'm so excited that we're gonna talk today about some COVID updates and local resources. Today is August 12th, 2021. We're not out of the pandemic yet, but
Not just yet. And
yeah,
that's what Dominic and that's what our program is all about. We're all about vaccine outreach, encouraging folks all around San Diego County to get vaccinated, but also sharing any sort of COVID-19 updates, doing educational topics, whatnot. And like Dominic said, we'll be going over some county updates. So with that being said, I'm going to go ahead and share my screen. So here on my screen, we have the County of San Diego COVID-19 watch. This was last updated on the 11th, so this is quite fresh information. As you can see here, the total confirmed cases we have are 309,406. Moving on over to the next slide. This slide here shows us the total cases and new cases being reported of COVID-19. As you can see here from April 2020, the cases were pretty low. Right here on April 1st, we have about 117 cases. But as you can see, as the year had progressed, moving over through summer, getting through the fall season, winter holidays, we started to climb up and up. Um, Through 2021, from just about January up until today, we've really not only doubled the amount of cases since last April, since last half year, but went above and beyond that as we're continuing to climb up here with the total number of cases, which is pretty to me that's pretty alarming, especially because vaccines have been administered since then, but cases still keep showing up. And a lot of the cases, the trends that we see in these new cases, a lot come from those that are still unvaccinated. Moving over to the next slide, this slide focuses on total tests. It's good to see that folks are getting tested. This one shows the rolling percentage of positive cases up to date. So as you can see here in December, it peaked up due to the holiday season, and we were going back down, which was great. I believe this was due to the vaccines coming out, people still practicing social distancing and whatnot. But as you can see here in July through August, we started to peak back up. And if you compare where we're at right here, it's similar to where we were at April last year, pre-COVID vaccine. Um, okay, and then here we go with this slide. This slide is covering the amount of cases by age group and by gender. As you can see here with the pie chart, COVID affects any gender, male, female, the percentages are just about the same. But what we can see here with the total cases by age group is that this age group right here, age 20 to 29, seem to be leading in the total amount of cases. With that in mind, for folks that are in this age group, 20 to 29-year-old, I highly encourage you to get vaccinated if you have not done so already. So you can go about getting to all these activities that we love doing, but in a more safe manner. With this being said, I'm going to go ahead and move over to the County of San Diego case rates. Now here we can see just about all of San Diego County is in the widespread transmission area. If you are living in an area that has widespread transmission, the CDC does recommend, even if you are vaccinated, if you are in indoor settings, to still mask up.
yeah, this was an announcement from July 28th. And it's kind of been hard for a lot of people to hear and get used to, because for a long time now, a lot of the public messaging around motivating folks to get vaccinated, one of those things that was said people could look forward to was that one day in the future, being around others without masks and indoors as well, if you're vaccinated. Well, it's still possible to get the Delta variant of the COVID virus. And it's become more contagious, right? It's a living thing, and it's like evolved to be more spreadable, more transmissible. So even though at one point we were thinking, oh, maybe we can all reach herd immunity with a majority of people getting vaccinated, unfortunately, it's likely we're going to be dealing with this for several more months to come, at least. And maybe herd immunity isn't necessarily going to be the thing to aim for anymore, but rather continuing to maintain vigilance by using all of the tools at our disposal, vaccination being one of them, wearing masks being another, washing hands, minimizing opportunities for the virus to be spread. So, okay, sorry, I'll get off my soapbox.
No problem. And I think by seeing the map like this, seeing the purple and white spread, it really just shows how serious and how real the Delta variant is. And I know it's been a little more over than a year being in this pandemic, but COVID is still around. It's still a thing,
Yeah, and if folks want to look at what we're looking at, you can go to the county website for coronavirus. It's like coronavirus, all one word, -19.com. And that'll take you to this main page right before the map. And then you can navigate over to dashboard and see all these live statistics for yourself, as well as all the ways that folks are calculating the graphs and the data. Like, what measures do they use to determine what color tier of risk, danger of catching COVID if you're in the area?
Because we have such widespread transmission, there has been more of a demand to bring back clinics. So I'm happy to announce that the county has opened up 4 more COVID-19 testing sites. We have one at the Lemon Grove Senior Center out there on 8235 Mount Vernon Street, Lemon Grove. The hours of operation are Tuesday through Saturday, 10 a.m. to 5:30 p.m. Also open now is the Northgate Market San Diego on 5403 University Avenue, San Diego. This one is only open on Wednesdays from 9:30 a.m. to 3:30 p.m. Opening up today, we have the North County Lifeline on 200 Michigan Avenue all the way up in Vista. This one is open on Thursdays from 9:30 a.m. to 3:30 p.m. And August 15th, the Border View YMCA is opening up. This one is located at 3601 Erie Drive, San Diego, open from Sunday through Thursday from 10 a.m. to 5:30 p.m. COVID-19 testing sites are free. SDSU is also opening up testing sites on their campus. So that's a great option. If you would like to see some other sites, you can go to the county website. You can search up testing locations by location or by schedule. So let's go ahead and take a look at what's open today on Thursday. Yeah, and you'll see that there's either walk-up test sites or drive-up test sites. They will also list some in which no appointments are necessary, locations where appointments are required, or locations where appointments are highly recommended, but not necessary to get a test at that site.
Mm-hmm. If you want our help with doing this too, like, you can just hit us up. You can message us on the platform that you're watching this video, or also reach out by text to 619-772-3598. Another number to text if you want is...
We have 619-613-7986.
Mm-hmm. We can walk you through anything online in terms of making an appointment if you want that. We can find you walk-in sites for not just testing, but vaccination. We can explain what types of things to look out for if you're not sure whether you may have been exposed to someone with COVID, or I mean, we always recommend folks go to their health care provider if they have one. If they don't have one, we can also help connect you as well.
Mhm. And also, if you are hesitant about getting vaccinated, or if you have a friend that is hesitant towards it, you're also welcome to reach out to us. We're fully vaccinated. We're more than happy to share our experience with you.
Yeah, let's see. Some clarifications just right off the bat. If you've already had COVID, or if you have a child or know a child who also has had COVID and is 12 or older, you can still get vaccinated. It is recommended because although there is some natural immunity you might be able to get from recovering from COVID, it's unknown how long it lasts. It's kind of variable. A more standardized and helpful immunity support to protect against severe symptoms of COVID would be that vaccination. And so it just kind of depends on how long ago your symptoms have resolved, because the vaccine providers want to be able to tell the difference between side effects you're having, which are expected from the vaccine, and making sure that that's not the same thing as like symptoms from a COVID infection. Um, that being said, you can't get COVID from the vaccine. There's no possible way, and that's just how they're made. We can go into detail about that later too if you want to hit us up. Also, Crystal, do you remember anything in the recent news updates we've been hearing?
I think I heard that Pfizer was pushing to get booster shots approved, I believe, but I haven't heard any updates on that.
Okay. Oh, here's what I wanted to say. Okay, so you know how the testing sites, more of them are opening back up again because of increased demand. One of those reasons for that increased demand is also that here in San Diego County, healthcare workers are going to need to be vaccinated by September 30th. If it's the two-dose shot, Pfizer or Moderna, then you would need to have your second dose by then. So if we were to count backwards, depending on the brand, it's either like 21 or I think 28 days in between, ideally, between the first and second doses of Pfizer or Moderna. That would mean that basically within the next couple weeks, people would need to get that vaccination at least started. So we can help with that, is just what I'm saying. And this is ultimately for the health and well-being of people, one of those many precautions. I mentioned Venn diagrams before we went on this call, and they're like my favorite thing ever. I came across this one, a diagram by the CDC. Here it is. Okay, can y'all see my screen?
Yes.
Great. So it's like two panes, one on the left, one on the right, and they each have three overlapping Venn diagram circles. And so this is called tips for reducing risk of getting COVID-19. And on one side, it says things that increase risk. And then reading the circles, there's no masks worn, indoor space, crowded space. And when you put all those three together, the overlapping spot says hotspot. However, on the other side, it's showing that there are also things that can decrease the risk of getting COVID-19. And that is if you're wearing masks, there's at least 6 feet of space between people, and being outdoors. Having all three of those in place would mean that you're probably in a safe spot. This is what I'm thinking all the time in terms of gauging my own safety in a certain situation. Like, oh, I want to go for a walk outdoors. Okay, well, am I going to go indoors at any point, or like be put in a situation where I'm going to be within 6 feet of somebody? Then maybe I'll go out without a mask, but keep one handy in my pocket in case I'm going to be indoors or nearby somebody else who doesn't already live with me.
A little mental checklist.
Yeah.
Before.
We also, a lot of us staff in this UPAC program still come in person to the office. When we're indoors in this building, we either have air purifiers going and fans and or the windows open depending on the weather. So trying to get that good ventilation, leaving doors open. Everybody wears masks. And if we're going to be eating, we definitely stay at least 6 feet away from each other. We also take our temperature every time we go into the building to make sure we don't have a fever. And if anyone is experiencing any symptoms, we stay home just in case. It's a little weird to think about it being over a year now that we've been in the pandemic, but we could still try to be careful and prepare with lists. Feel free to reach out to us for assistance with that too. Like, especially if you're a caregiver, having in place like a safety plan, supplies if possible, in case anybody needs to quarantine or find places to do so if where you're living isn't the best. So, yeah, we're just still out here doing what we can to help everybody in our community make informed choices and get the right, accurate information in a timely way, and just trying to remove any kind of obstacles to getting people's needs met.
Mhm. I think that was a great way of closing the Zoom call.
Oh yeah, it's 4 o'clock. Wow, time flies. That's the theme of the day, maybe. Okay, well, yeah, thanks so much, Crystal, for chatting with me and going over a few of our updates together. And
Yeah, thanks
um,
for sharing all of that.
you as well. Yeah, it's really good to, be part of a group where we're informing each other of the updates as they change, and knowing that with our awareness of resources combined, we can help a lot of people in a lot of ways.
Absolutely. If you would like to follow us on our social media, if you would like to follow content that Dominic and I closely work on regarding COVID-19, that one is UPAC_CHWCOS. And that one is run by our community health workers. We occasionally hop on Thursdays doing IG Lives. We either share our vaccine experiences, we give county updates there, just all things COVID-19 chat. Yeah, lots of good stuff on there.
Yeah. Oh, yeah. By the way, we are funded by the County of San Diego in support of the Live Well San Diego vision for safe, healthy, and thriving communities. In particular, Native Hawaiian, Pacific Islander, and Asian residents of San Diego County. But of course, our services are free and available for everybody. These are some of our phone numbers y'all can reach out to. We have a couple landlines for our main office in Golden Hill. That number is 619-232-6454. And you can try extension 817. Let's see. I also wanted to share a sample of some of the flyers that we give out when we go door knocking. Twitter, UPEC_SD. And if you just kind of search in Facebook, UPEC, you might get a few different options, but UPEC COVID-19, all one word. And you can message us in any of these ways. And since we're going into the weekend, I also wanted to share real quick a couple events coming up at the Malcolm X Library. There's going to be an event for youth ages 12 to 18. If y'all want to learn how to make zines, there's this little creative zine making workshop being put on, and here's a flyer for it. And at the end of this month, there's going to be a community garden exchange as well in Altoona Park, National City. It's free. If you want free produce, you don't have to bring any, but if you happen to grow any, you can totally bring it to share as well. And so it'll be a nice community event. Something else this weekend is a backpack giveaway. Yay!
Alrighty, well, thank you, Dominic, for sharing these great events happening.
Yeah, thank you. And we'll talk to y'all again soon.
Bye, everyone. Thanks for watching.
Bye.